All right. Hi, everyone. Thank you so much for joining us today for Elite Medical Prep's Residency Roundtable. I am Brittany. I am a third-year Med Peds resident at University of Pennsylvania and Children's Hospital of Philadelphia.
And my name is Savannah. I'm also a third year resident in the combined medicine and dermatology program at the University of Pennsylvania as well.
And today, the two of us are going to be discussing applications in more than one specialty.
So for the objectives today, we're going to talk about the process of dual applying, and that's applying into multiple specialties. We'll talk about the pros and cons of that and talk about also combined residency programs. What are the pros and cons of combined residency programs like a Med Peds or a Med Derm program, and what the process of applying to those programs looks like. And then we'll talk about who's a good candidate for each of these programs and what are some considerations in making these decisions.
So first and foremost, to define dual applying, this means applying into two different specialty programs during one application cycle. And you're ultimately going to match into just one of those specialties. This is not a combined program where you will come out of your residency with degrees in both of them.
So the ideal candidate, there's multiple different scenarios where someone might consider applying into two different specialties. Commonly, this is someone who hasn't made their final decision about what exactly it is that they want to do. You get to see a lot of really cool things as a medical student, and sometimes it's really hard to know which path is right for you. And so you want to keep options open when it comes time to submitting applications. There are also, these are people that want to kind of leave some options open where other options might be more limited. So for example, if you're very limited geographically, if your couples matching, if you're interested in a very competitive field and you're unsure about whether or not you might match into that field, or if you have red flags in your application, you might consider dual applying. And this commonly would be applying into almost a backup field that would be a little bit less competitive and keep your options open.
So what are the pros and cons of dual applying? So as Savannah alluded to, the pros of this are that you have a greater chance of matching. There's more opportunity, there are more spots when you're applying to multiple different specialties as opposed to just one. This also leads to a greater chance of becoming employed at the end of this cycle. Lastly, I think the pro of this is that if you have not yet made your decision about what your final career path will be, this gives you some more time to keep your options open. The application process starts the summer prior to your fourth year of medical school and goes all the way through March. And by dual applying, you can sort of put off the decision of exactly what you want to do a little bit later into the cycle. Now, unfortunately, there are cons of this process as well. The first being that it is more expensive as you pay per application during an ERAS cycle. It's also a bit more complex in terms of the details of applying, which we can talk about in just a bit. And it's time consuming. Additionally, there is some talk of there being stigma associated with dual applying. Some people think that people who do this are looked down upon, and we can talk about as we go through this presentation how to sort of avoid that stigma and what our takes on it are.
So the question that you have to ask next is, how do you go about this process? It's really important that when you put yourself forward in an application, you always put your best foot forward. And so you really want to make sure that you are doing your strongest application for both fields that you're applying into. The first step is to identify mentors in each field. We would recommend that unless you're specifically asked by programs whether or not you're going to dual apply, it's not something that you need to bring up, but you definitely do want to have mentors that can give you good advice, that you trust, and who will advocate for you when it comes time to applying. So for your ERAS application, you're able to submit multiple different personal statements and choose which programs you send them to. And it definitely is in your favor if you complete a different personal statement for each specialty that you're going to apply into. That's because you really want to highlight the characteristics about yourself that make you a great candidate for that field in particular. And you may want to explain your interest in that field. And so this is another thing that you can discuss with your mentors about how to make the best personal statement for that field. It's very important though, when you do come time to submit, that you pay attention and double and sometimes even triple check to make sure that you're sending the right personal statement to the right programs. And so this is where it helps to have somebody who can help you look over your application and make sure you're checking the right boxes.
The next step is that you're going to need to do double the number of interviews since you're only going to be interviewing for one specialty at a time. And so just managing your time and deciding which interviews you say yes to and being very careful with your calendar for interviews will become important as the cycle goes on. The next thing is what to do during those interviews. So I think a big question that a lot of students who are dual applying get asked is, how much should you disclose about your application process? And we highly recommend not necessarily disclosing yourself, but also not lying. So if you are asked if you are dual applying, you should absolutely be honest and tell your interviewer what your goals are, why you're dual applying, and which direction you're leaning in terms of your favorite programs thus far. That being said, if you don't get asked about it, it is not something that you necessarily have to share. And lastly, after interviews, when making a rank list, this is where the cycle sort of comes and becomes combined. And so you will only make one rank list. And on that list, you can mix and match programs from both of the specialties that you interviewed for. So for example, if you interviewed for internal medicine programs and pediatrics programs, the first one on your list may be a medicine program, and the second program on your list may be a pediatrics program. Some people may choose to rank in chunks, putting a group of one specialty first and then a group of another specialty second. But what's great about this process is that's not a decision that you have to make until you get to the point of making a rank list. Ultimately, though, you will only match at one program, and you can't really predict in advance which of the specialties that will be into if you are putting both specialties on your rank list.
So that kind of wraps up our discussion about dual applying. That means that you apply into two separate programs. Next, we're going to move on to talking about combined programs. And these are programs like the program that I'm in and the program that Brittany is in, where you complete an entire residency training for two different specialties. And at the end of this, you do end up taking boards examinations in both specialties. And there's a lot of independence in terms of how you choose to practice. And so some examples of combined programs would be internal medicine and pediatrics like Brittany's, internal medicine and dermatology like my program, internal medicine and emergency medicine, internal medicine and psychiatry, and then pediatric psychiatry or the triple board. So next we'll talk about my path. So here we outlined what the path would be for a classic medicine applicant and a classic dermatology applicant. So PGY1 as a med derm applicant, you're doing an intern year. And across the board, it pretty much looks the same, except for if you're doing a prelim year in a transitional pediatrics or surgery program. PGY2 for my program is entirely dermatology. And then PGY3, 4, and 5, I jump back and forth between internal medicine and pediatrics. As you can see, if I had chosen to go internal medicine in a categorical program, I would have done 3 years of medicine, and then after that, go to fellowship or start working as an attending. And then as dermatology, you do a prelim year, 3 dermatology years, and then you leave for fellowship or an attending position.
I'll talk a little bit about my path in combined internal medicine, pediatrics, or med peds program. So a PGY1 year in med peds is an intern year where you're going back and forth between the pediatric hospital and the internal medicine hospital. If you were a categorical resident on either the medicine side or the pediatric side, you would also be completing an intern year, but solely in whichever fields that you are a categorical resident for. During the PGY2 year, Similarly, you become a junior resident in the MedPeds program, and you're going back and forth every 6 weeks to 2 months between each of the programs. That is pretty similar to the junior resident experience that your categorical peers are having during the PGY 2 year, except that they're only having that experience on whichever categorical program side they participate in. Where things start to deviate a bit is in the PGY 3 year. And as a MedPeds PGY 3 resident, I'm still considered a junior resident. And some of the rotations done by junior residents are a bit different, and this will vary from program to program, but they're a bit different than some of the senior resident rotations, which my categorical peers are considered by the time they are in their PGY 3 year. And finally, for a PGY 4 year, I am still a resident. I will be a MedPeds senior resident at that point, whereas my categorical peers will have left and graduated, either beginning their fellowship training or working as attending physicians. So for both Savannah and I, doing combined programs certainly does extend your training beyond what either of the categorical programs would have been individually, but it's still less time than if you were to complete each of those separate specialty trainings individually. So MedPeds, for example, is 4 years total for both a medicine and pediatric certification, whereas if I had done each program individually, each is 3 years, and putting them together would have taken 6 total.
So again, the ideal candidate is a little bit different for this scenario. Here, if you're considering applying into a dual program, you do want to make sure that you're fully committed to each independent specialty. There are definitely programs, for example, if you're interested in complex dermatology, you don't have to complete the entire internal medicine training. So you want to make sure that you're somebody who is dedicated to completing a full residency training in each specialty. You have to be somebody who's independent and proactive. Oftentimes, the combined programs are much smaller, and you really need to make your own path and make sure that your priorities are met in your program, because there's not as much precedence and kind of flow as some of the other programs. Finally, it's really important that you come in with some confidence. Of course, this is a skill that gets built over time, but as Brittany and I both outlined, our program is longer, but we spend less time. For example, as a PGY3, I've spent less time in internal medicine than my peers in medicine. And so coming back can feel like a rough transition where you've had a lot less time in the specialty than your peers. You also need to really be confident in trusting your decision. A lot of people sometimes have a hard time understanding why you've decided to complete 2 residency programs. And so that can be a challenging conversation to navigate many times, to explain to people why you've chosen your route. And so it's good to kind of really think through this decision before you enter this route.
Absolutely. Before we move on to the next slide, I also just want to add the ideal candidate for these programs is typically somebody who has pretty clear career goals long term, in which you feel like you will be using both of the specialty trainings that you obtain. So, for example, people who go through internal medicine, pediatrics combined residencies are often interested in taking care of adult patients who have childhood onset conditions, or taking care of adolescents and young adults more in the pediatric setting who are now starting to deal with adult onset conditions. For me, for example, I'm interested in taking care of adult patients with congenital heart disease. And so this is a path in which I truly will be integrating both of the trainings. We try and discourage people who just sort of like both specialties and haven't yet made a decision from applying into a combined residency purely for the purpose of not knowing what they prefer. Man, I'm not sure if you want to share as well what drew you to MedDerm and what made you the ideal candidate.
Absolutely, and I totally agree. So what I'm interested in doing as a MedDerm graduate would be caring for individuals who have internal malignancies and have dermatologic sequelae of either the treatment or the malignancy itself. There are people who do all sorts of different things, like working on inpatient consult services, working in travel medicine and infectious disease with a dermatology focus. And so all of these things really focus on bridging that gap in the intersection of two different specialties, and that's where you can make a difference for patients.
So a little bit about pros and cons of these combined programs. First, for our pros, you certainly have the opportunity to develop a niche. For Savannah, it will be treating malignancies with both internal and dermatologic manifestations, something really specific. Additionally, you get to join a community of like-minded peers. All of the people who will be in these combined training programs with you are people who have very thoughtful career goals and are really excited to be there and participate in both of the trainings. Additionally, you will have the opportunity to really learn a unique approach to medicine. You're learning two different perspectives, and you have the opportunity to not only take that in, but share it with your peers on each side and teach them new skills, both formally and informally. And lastly, just exceptional patient care. You're learning how to provide patient care in different settings, and that makes you an overall better doctor for all of the people that you'll be caring for during your residency and beyond. Certainly, there are some drawbacks to combined programs, first and foremost being the time commitment, which we've discussed at length. There are fewer spots in each of these programs than there are in categorical programs. And lastly, some people are worried about lack of structure at some of these programs. It can feel like you're jumping back and forth between two programs, and you really want to find a program that's a good fit for you in terms of how they organize that jumping between different specialties. And then lastly, you may hear from people who are advising you that it's difficult to integrate into a field when you come out of these programs, and that you may be pushed to choose one of the specialties. I think both Savannah and I, as people who have chosen to go this route, strongly encourage you to consider it if you feel like there is a specific niche in which you can share your talents from both specialties. And there are certainly ways that you can craft careers that will involve both.
So applying into a combined program is a little different from applying into two separate programs. So again, mentors are very important in any residency application. And in a combined program, it's relatively unlikely, unless you're at a school that already has a combined program, that you will find a mentor who's done the same training as you're pursuing. So you want to make sure that you can find mentors in each respective field that will take an interest in your interests and advocate for you. If there is a combined program at your school, definitely reach out. And if there's not, you also are encouraged to reach out to programs at other schools or other hospitals to see if there are current residents or faculty members who would be interested and willing to talk with you. Again, these programs are very small, and so personal introductions do go a long way, especially in sifting through the long list of many people who are interested in applying to these programs. So when it comes time to ERAS, you would interview for these programs as one unit. So instead of applying to internal medicine and dermatology at University of Pennsylvania, for example, I applied to the medicine and dermatology combined program. So I had a single interview and a single application. For that reason, since you're only checking one box for each program, it's best to have a letter of recommendation and personal statement that addresses the combined program itself. So if you do have mentors who are willing to write you a specific letter about being a combined applicant, that is really a plus side on your application. And if you have a personal statement that can clearly outline why you're interested in applying to a dual program, that's also really important.
So as we come to our conclusion, we leave you with some questions about considering if you should apply into combined programs or dual apply into multiple residency programs. Firstly, you should consider combined programs if you truly have a passion in both fields and there's a specific niche that you think you can accomplish with the training that you'll get from both residencies. This will mean extended training time and that you may have to forge your own path more than if you were applying into a more common categorical program. Dual applying is certainly for people with multiple interests, if you can see yourself in either field, but not necessarily need both as part of your future career. It's also something to consider if you have other limitations to your application, like geographic restrictions, couples matching, or red flags that will hinder you from matching. And lastly, you don't necessarily have to decide between the two. Many people can do both. People who are interested in med-peds, for example, will often apply to combined med-peds programs, but since spots are limited around the country, they will also apply to some categorical medicine programs and some categorical pediatrics programs to expand their opportunities and ensure that they match.
So that was a lot of information. Thank you so much for listening closely and tuning in. Again, if you have any questions, we're here to help. So please direct your questions to the team at Elite Medical Prep, and we'd be happy to help you accomplish whatever it is that your dreams are for residency.
Thank you.